South Carolina's 988 Suicide and Crisis Lifeline is open 24 hours a day, 7 days a week for those in need. And after hitting a major milestone, staff says they are preparing to save more lives than ever before.
Peyton Furtado is live with more on new funding and new plans to help South Carolinians. Peyton?
Yeah, Carol, this month 988 celebrated its 1-year milestone since it was rolled out to South Carolina. They say they've faced their fair share of challenges, but new funding could help with that.
It's going to save lives.
Based in Mental Health America Greenville, 988 answers 110 to 120 calls a day, nearly 30,000 its first year. According to staff, the calls keep coming. With staffing challenges, 988 was able to pick up about 67% of calls their first year. The rest were routed to the national hotline.
It really boils down to just knowing the environment that the caller is coming from and our local resources. We have a robust Department of Mental Health with resources like mobile crisis units and community mental health centers, and someone in a different state might not know about those resources specifically.
This month, new state funds will allow Greenville's 988 to more than double its call center staff.
Call anytime. We talk with people having anything from a bad day, a bad hour, to all the way up people who are having serious thoughts of wanting to hurt or kill themselves. But intervention begins with prevention. And so if we can talk to someone when they're having a bad day, it might be that they never reach a point of thinking about taking their own life.
On top of staffing, the state has set aside $45.5 million to 13 South Carolina hospitals, 2 in our region, to build crisis units for those in need of further care.
It's trauma-informed. It's meant to be a peaceful, healing environment so that someone who's thinking about suicide or is having a mental health crisis isn't sitting in a waiting room, a crowded waiting room with 50 other people. They're not isolated in a dark room by themselves.
The unit and funding, part of a statewide movement to address mental health at its root. Yeah, 988 also opened a new call center in Charleston just last month. Those 2 hospitals in our region getting crisis centers are AnMed Medical Center in Anderson and Prisma Health Oconee County Memorial Hospital. Live in Greenville, I'm Peyton Furtado, WYFF News 4.